When John Goolsby was getting discharged from the VA hospital, he was homeless and had nowhere to go.
Where am I going to go? What am I going to do? Is there anybody that can actually help me?
Those were the thoughts running through his head. He had been offered help before, but he lost trust.
It seemed, in some cases, it seemed like there's not really any help out there for single males. It's just a time, and it is hundreds, if not thousands, of people out there that's in a similar situation, and it's just heartbreaking.
Interfaith Community Services offered Goolsby recuperative care straight from the hospital, so he gave it a chance.
Very kind, caring people that kind of didn't push me, didn't force me to do anything. Just basically, they kind of guided me and directed me to help with the resources to help myself. I've over a few months there, I've actually recovered, got my confidence back.
A caseworker helped Goolsby start from scratch and work towards a brighter future.
What's next for me? Looking for an apartment right now, studio, probably, because I don't need that much space. And being that I've dumped all the material, I don't feel like I need it. So I'll have like the basics. I want to go back to school, educate myself. I want to get back into the community and give back to help others.
Interfaith's Hawthorne Resource Center is where Goolsby was able to recover and regain control of his life. It's a 32-bed facility, but Interfaith has much bigger plans, with a 106-bed care center scheduled to open in a couple of months, in what used to be a motel. Greg Angel is the CEO of Interfaith Community Services. They've been working on the project for 2 years.
So much has gone into this project that it just took time to bring a 1970s era budget motel to 2022 residential care facility standards.
The property will offer a space where homeless people can heal following a hospital visit,
where we'll help them recover from the medical procedure, or if it was a psychiatric hospitalization, we'll help them get stabilized with their mental health. And then we'll help them actually secure a stable home to move out of here into.
But healing is only part of the mission.
Here, we have registered nurses, we have licensed vocational nurses, social workers, and case managers to help an individual heal and recover, and then identify the strategy and complete the strategies to end their homelessness.
Angel says the alternative to this space is discharging homeless people back onto the streets, or to a shelter that may not be equipped to follow a plan of care. Once the new Abraham and Lillian Turk Center for Recuperative Care is open, the old Hawthorne facility will get a new mission: to help homeless families.
So it's more and more common that we have families with children coming to us who are living in their cars, who are finding refuge on our streets. And so this center will be a place of short-term housing and support to help those families get on their feet, to support those kids and those adults and get them into homes of their own.
Both centers are expected to open by January. Tania Thorne, KPBS News.